My name is Jeff Spain. I'm the director of the Manufacturing Extension Partnership at Columbus State.
Very glad to hear that. And also very pleased to have Morrow County Commissioner Stephanie Bragg join us with the program. So I'll get out of the way here and let the experts take off and share a lot of good information they have for you this afternoon. I do want to mention our intention is to record this program, so please be aware of that, and then we hope to make it available afterward for those who haven't been able to see it. Thank you. And so with that, I want to turn things over to Jeff Spain, who's the director of the program at Columbus State. Thanks.
Hey, thanks, Andy. I appreciate that. So good afternoon. And on behalf of the team at the Manufacturing Extension Partnership at Columbus State and the great team that's been put together from Morrow County, thank you for joining us with part of your afternoon today. Over the next 55 minutes, our intention is to walk through best practices and strategies for our new normal manufacturing the age of COVID. We've assembled a team of subject matter experts, and we reserve time to answer your questions at the end of the chat. What we would ask is that you use the chat feature on WebEx in order to enter your questions. We're keeping track of them as we go forward. A couple of points of housekeeping I'd like to ask if everyone could ensure that you keep your microphones muted as much as possible. That'll help eliminate some of the echoing we have. And definitely utilize that chat feature to ask questions so we can keep things going for you. With that, it's my pleasure to introduce the Morrow County Health Commissioner, Stephanie Bragg, to walk us through a few phases of what we're going to be seeing with COVID. So, Stephanie?
Good afternoon, everybody. Can you hear me?
I can confirm that we can hear you.
Okay, because sometimes I mute myself thinking that I unmuted and it's a thing. So what I'm here to talk about is just the basics of COVID-19 and stuff like that, just from a health department perspective, I guess. So we've got the first slide up. Viruses in general, they can't spread by themselves. They have to have people do it for them. If somebody has immunity to a virus, their body recognizes it, and then their body stops the virus from getting sick. Someone doesn't get sick, they can't spread the virus on to other people. That's what usually happens. But viruses are pretty tricky, and they're always changing themselves just a little bit to try to confuse people's immune systems. If a virus changes just enough that a person's immune system doesn't recognize it, then it can infect that person, get them sick, and then the virus can be spread on. Every now and again, a virus changes enough that then a whole new virus is created. When this happens, we're pretty lucky that it doesn't happen very often because it can create all kinds of problems. Because with a new virus means there's no previous information on it, no treatment, nothing like that. So everybody's starting from scratch with it. So in 2019, a new virus was so-called born into the coronavirus family, and then it made its way into the population. There's a few viruses in that family that cause disease in people, including the one that causes the common cold. Then there's one that causes that SARS that was from like the early 2000s, was kind of a big scare with the severe acute respiratory syndrome disease. And then this new virus that its official name is SARS-CoV-2. That virus, the SARS-CoV-2, causes the COVID-19, which is the disease that we're all talking about now. Each of these viruses in the family affects people differently in the matter of how severe they're affected. So like a common cold virus causes mild, you're pretty okay. When you have it, you just feel like yuck for a little bit. SARS causes a severe disease that can cause really bad problems with breathing. A lot of times those people would have severe respiratory issues, have to be in the hospital, and so forth. This new virus that causes COVID-19, it sits somewhere in between the two of them, but it's closer to SARS than it is to a cold. So more severe than a cold, but not as severe as the SARS was. Next. Okay, so now we have the early infection information. Like I said, with this virus being a new virus, we're still learning things about it, and information changes all the time. But what we have now is our best information that we have. So you get infected with the virus from inhaling it through your mouth or your nose, or from taking your hand and touching your face. And I don't know about you, but I touch my face about a bajillion times a day. And the more I try to not do it, the more I end up doing it. The incubation period for the virus is about 5 to 7 days on average. Children tend to kind of incubate it a little bit longer. Some adults take longer. And then in the severe cases, it migrates to the lungs and causes the pretty bad respiratory stuff. So you're contagious with it. So how you're going to spread it is it starts about 2 to 3 days before the symptoms begin, which is kind of unfortunate because you don't even know you're sick and you're spreading it around for 3 days. And then your contagious period is over. Once you get sick, your period is over after there's been that. After there's been 7 days since the symptoms began, any non-fever symptoms have improved, and you've gone 72 hours without a fever or without having medicine to make you not have a fever. So you have to be Tylenol, Motrin free for 72 hours and not have a fever. Next. The symptoms for COVID-19 are kind of all over the place. Most frequently, you're going to have a fever, a dry, non-productive cough. You might feel some shortness of breath. It's common to have a headache, somewhat common to have a sore throat, and then a new loss of senses of taste or smell. That's something that they've found that's creeping up quite a bit with it. There's also some symptoms of having trouble breathing, having chest pain or pressure, being confused more than normal, and then having like a bluish tinge to your face or lips because you're having a lack of oxygen. Those symptoms are less frequent than the other ones. But then there's also some people that have absolutely no symptoms at all. They never have any fever, they never have anything, they feel fine, and then they test positive. So it's really all over the board. And a lot of these symptoms that we're talking about, they sort of, they're similar to other illnesses. So it's kind of non-specific on what you might be sick with. Next. So transmission pathways, there's lots of different ways that you can spread illness. For the most part, for COVID-19, it's droplet transmission. The nice little picture on the slide with the guy coughing or sneezing. So the large droplets are the ones that go out a certain way and then they fall. So they're thinking between a person and 6 foot. That distance is where the large droplets are going to end up going. And then the smaller droplets, those go farther because they don't weigh as much. For the most part, with COVID-19, it's thought to be spread mostly through the large droplets. So you have to get a sufficient viral load into your mouth or nose so that you can get infected. It's most easily spread through close contact with someone who's sick. And so for our purposes, we define close contact as within 6 foot of someone and then for 15 minutes or more. Because if you're just walking by somebody, the chances are fairly low that you might get sick. But if you're in fairly close quarters with somebody, you know, people don't even have to sneeze or cough. Some people just kind of spit a little bit when they talk, and it can get spread that way. Then next slide. Okay, so then I just have a couple of finishing up sort of things. So again, in order for you to get sick with it, you have to get a sufficient amount of the viral load into your mouth or nose. And you get it from someone who is already sick, but like I said, you can transmit or transfer that up to 3 days before you even start showing symptoms. The virus is viable on surfaces for up to at least 72 hours. And then again, we're still learning stuff about it. So for some surfaces, it could be longer. They're pretty well saying that for 72 hours, it's going to be viable and you can get sick from it. And then, though often the illness isn't going to cause severe illness in most people, but there are some people that can have pretty severe effects from it, end up in the hospital and stuff. And then even if you don't have severe illness, you could have health effects that last for a while. That's all I have about the virus. and then I'm going to introduce Dr. David Stein, and he'll be discussing mitigation strategies. Thank you.
Good afternoon, everyone. Thank you, Stephanie. Can I get some verification that I can be heard?
Yes.
All right, excellent. Now let's talk about the nitty-gritty about mitigation strategies. Just to set the stage a little bit, what we're going to be discussing is a set of best practices that we have assembled from a variety of sources. And we're using federal sources like the CDC and OSHA. We're using state sources like the Responsible Reopen Plan that the governor just put out yesterday, and also industry groups that have been working with their members to find out what really works best in the field. So this is the best information that we can find about how you can mitigate the transmission of this disease within your facilities. A particular note, as we go through these slides, you're going to see that some of those bullet points are in italics. Those are the guidelines that are listed as mandatory for manufacturers in Ohio as a part of that Responsible Reopen Ohio plan. So you're really going to have to make sure you're doing your best to adhere to those, because those are the ones the state feel are most important. But I will say before we get into this, we know that every facility and process is unique. So you have to use your best judgment of how to apply these guidelines to your particular situation. And at some point, you're going to get to a situation where you don't know how these guidelines really apply. And when you get there, I would say your guiding principle should be take a step back, go back to this information that Stephanie just gave you about how the virus is spread, and just think about how you can break that pathway for transmission. And I would also say, if you get to one of these situations, don't hesitate to reach out to your partners, whether it's the MEP or Stephanie at your local health district. Like, we are here to help. So let's get right to strategy one, and that's just to keep the virus out of your facility. The first way to do that is just, to the greatest extent possible, enable remote work. That is something that the governor has put out as a guideline for manufacturers. Now, they're leaving it to your discretion to figure out what to the greatest extent possible is. But the way to look at this is, you're not just protecting those workers who get to stay at home and are working from home. You're also protecting everyone who has no choice but to come in. The name of the game is really just limiting interaction between people who could be contagious. As we know, a lot of the people who are contagious are pre-symptomatic or going to be asymptomatic throughout the entire disease. So you kind of have to act as if everyone is potentially contagious. So just the fewer number of people in your facility, the better. Along with that, you need to control access to your facility. Only allow essential staff and visitors there, and only keep the staff and visitors there as long as they have to be. Don't let people loiter around after their shifts. Don't let visitors go around to visit. That sort of thing. One way to do that is just to limit to one entrance. That way you can be sure you know everyone who's coming in and out and how long they're there. Along with that, and this is another one of the mandatory things from the governor, is you have to do a daily symptom assessment. We don't have the public health order yet. We only have the sort of poster or PDF that was sent out yesterday. It says that you have to check for your temperature by thermometer, to look for a fever, and also be looking for shortness of breath or difficulty breathing and cough. So those are the ones they really want to be looking out for. But you have to have that daily assessment as people are coming in and out. If you do see people who have these symptoms, or they develop them while they're at work, send them home. And then if they were at work for a while, you're going to want to sanitize the area that they were in. But that's for a future slide here. The main thing for here is just, now's not the time for toughing it out. One person who is contagious at your facility, spreading it to the rest of your workforce, can really cripple your ability to do business in just a week or two, right, as it spreads from one person to the other, because the other workers are going to have periods of time when they're contagious but not symptomatic. So it's really, this has got to be a culture change, not just at your facility, but also sort of just in the general culture. So you really need to be reinforcing that through communication, whether that's signage, trainings, which could be a little tough because you don't really want to bring many people into a small conference room to train. You might have to do emails, you might have to be a little creative about it, but you really want to not just do it once, but continually reinforce the changes in culture that are needed to help stop the spread of this. And the last thing is when you're doing this, what happens outside of work is important. Now, you don't have control over what your workers do outside of work, but you want to impress upon them that every interaction avoided is a chance for transmission that can't happen. It's not the time to go back out and live life like we did before this pandemic. Hopefully we will get there and might have to wait till we're after a vaccine, but for now, you want to only go out when you have to, and you want to just limit your interactions with other people as much as you can. So that's strategy one. Now let's move to strategy two, which is just enhanced hygiene measures. And the one nice thing about this, we can make this change in our culture, is it's going to help not just with COVID-19, but it's also going to help with the common cold, the flu, other less severe illnesses that tend to go around workplaces. So I think this will, in the long run, is going to be good that we're going to take this time to focus on better hygiene. The first step on that is we know one of those transmission pathways is you touch a surface that has the virus and then you touch your mouth. So proper hand washing can kill the virus. We know it's the soap itself and that physical rubbing that breaks down the virus. So you want to do it, soap and water. Water helps distribute the soap. 20 seconds gives you enough time to get all of your hands, not just the palms and the insides of your fingers. You want to make sure you're getting the sides of the fingers, the backs of the fingers, and the back of your palm. Just get the whole hand. You want to kill the virus on all the surfaces there. And you want to do this regularly, 6 to 7 times a day, maybe not all at work, but throughout the day. So every couple hours, you should be washing your hands just to make sure. There are going to be times when you can't go into a restroom and have the soap and water and wash your hands. For those times, hand sanitizers can be very effective as long as they're the right kind. So try to make that available at places. You see them at grocery stores where right as you walk in and as you leave, you can sanitize your hand. And that's some great places. Or when you're walking onto the plant floor, having a place there, that can be another key area for it. You want to avoid touching your face. Stephanie mentioned that she's not good at it. I'm not good at it. I'm trying my best to teach myself to not touch my face. It's tough, but again, you just want to kind of reinforce that you want to avoid that. One thing that can help, and we'll be talking about this a little bit later, is when you have some sort of face covering, now you have a physical barrier between your hands and your mouth, and it's harder to do that. So that can help. Next guideline is, you want to teach people how to cough and sneeze properly. That seems a little weird to say, but a lot of people just put their hands up. I have been known to do it as well. You really want to either go into a disposable tissue that can then be thrown away, or into your elbow, something that you're not generally touching to your face all the time. Tissue is very cheap and still very available. Trash cans are still very available. Having those around everywhere is just going to make it a lot easier for people to get in the habit of using the tissue. So, it's going to be a real cost-effective way to help stop the spread of the disease. And next is just, people are breathing. They're going to be getting, if they're contagious, get a virus on surfaces that they're near. So these high-contact surfaces you want to clean frequently. The state guidelines for manufacturers in this Responsible Reopen Ohio plan says it has to be done daily. Everyone that we've talked to as far as industry groups say you want to be doing that more frequently throughout the day. You don't want to wait all 8 hours, 12 hours, 16 hours, however long your facility is open before cleaning it again. You want to get somebody in there disinfecting countertops, desktops, doorknobs, that kind of thing, multiple times a day. But you do need to do it at least daily, and that includes desks and workstations. And last, as you're developing your plan, don't forget those transient surfaces, your raw materials, your works in progress, the vessels that that are a part of that, that are transporting those around. It's easy to forget about them because they're moving around the plant, but they also need disinfected. So for the next two strategies, I'd like to introduce Tom Rogers. He is the president of Mainspring Solutions. We at the MEP know him more as one of our subject matter experts for optimization of operations. He's got 30 years of experience in the field in manufacturing. He teaches at the Fisher School of Business, and he's been working with the MEPs for many years here in Ohio. So with that, I'll give it to Tom.
Thanks, David. Everybody can hear me?
We can.
Awesome. So Stephanie and David have done a great job of setting the framework for what we need to do and all of those best practices. Now we're in that facility and we're having to look at everything differently. And from, again, highest risk, right? How close are we? When we look at in our facility, our workstations and transitions, are we able to keep those 6-foot distances and the time apart? We need to start thinking about that and walking through our processes in our buildings. When we look at the lower, it's everything, as they've talked about. Low risk interactions. How many times are we passing in the hallways? We talk about, David mentioned, entrances and exits. Well, at shift changes, at lunch changes, there's going to be that interaction probably more than we're thinking about or more than we're used to seeing, even going into the restrooms. So how do we really pay attention to that and highlight what kinds of things we can do to work around those types of issues? Avoid putting people in enclosed areas for extended periods. So do we have shift meetings? Do we have, we'll talk about break rooms, but how are breaks done? Do we have a morning huddle? Are there certain things that we do on a daily basis that are going to put people in close proximity to each other and in enclosed rooms? We're going to have to rethink that, right? And come up with different plans. Limit personnel in common areas, right? So everybody's kind of used to this. Hey, we've got a bell, typical manufacturing environment. We've got a bell that goes off for break, and a bell that goes off for lunch, and a bell that goes off for our afternoon breaks. Well, now, that doesn't mean everybody goes into the break room. That doesn't mean, we may have to do some things differently with regards to staggered breaks, with where those breaks should be. Luckily, we're getting some nice weather finally in Ohio, so maybe some of those breaks can be taken outside, where we can again maintain those barriers, those distances from each other. Even at the desk level, from inside the facility, when you talk about office space and cubicles, are we able to move things around? A lot of people in conference rooms are taking out chairs and spreading, instead of just saying every third chair, they're literally taking the chairs out of the room so that, again, we can maintain that space, that 6 feet away, without having to really think about it. Because, again, if you're like any of us, we have these habits, right? I'm doing everything I can not to touch my face right now. And so when we think about when we walk back into that natural setting of our work, we're going to naturally want to sit next to each other. We're going to naturally do things that we're going to have to try to break. And some of those things we can do by physically not allowing it. And so think about that when you have conference rooms or even your break room. Do I want, all the tables that are in there right now? Do I want all the chairs that are in there right now to really help space things out? Again, think about maximum capacity, 50% of fire code, right? So when we bring in our shifts and when we bring in our people, how many people are coming in? And should we look at doing things differently to avoid those times when we're potentially over capacity per the guidelines. Ventilation is good. Again, we talk about, there's filtering, there's windows, if we can open up some dock doors, all of those things, now that the weather is getting better, helps us to remove as much of the risk as we can on our ongoing day. Next slide. Thank you. Again, physical barriers, right? When we walk into our facility, should we have a checklist so that we can go through and see how close are our physical barriers, or our workstations need to be close? Have we taped things off so that we understand where those limitations, where those boundaries are? Crazy things to think about. If we have a manufacturing assembly process and we're passing, whether it's pieces, whether it's carts, all of those items that go from one process area to another process area, what are we doing to make sure that all of those maintain cleanliness, disinfection, those types of things? And we put together a little checklist to help with that. But again, it's a really big thing to start thinking about time clocks and carts and desks and, forklifts, all of those things that we have interaction with. So how do we keep everybody safe, yet are able to operate efficient? HEPA filters, another resource. So, your maintenance crew with your air handling units, can we get do we need to change our filters now? Can we get new filters? What are those processes? Obviously, we're going to require mask use. There are some resources that I think Brent and others will bring up, but, do you have an adequate supply of masks, or is it face shields? Depending on what your operation is. And I would test them out. I have a very good, thank you. I'll stop hitting the desk. I have a good friend in manufacturing, and they require safety glasses. And they found that safety glasses and masks, the safety glasses actually fog up. So whatever solution you're going to come up with, make sure you test it out, because it may cause different problems, and you may need to face shields versus face masks, but some sort of face protection. Again, the homemade masks catch some droplets. Face shields can be preferable, but ultimately, what are those steps in place, and documented so that everybody understands walking in the door what they should be doing, what's acceptable, and they feel safe when they walk into their facility. That's it for me. I'm going to pass it back over to David.
Thank you, Tom. So we have 3 more strategies to go, but I want to let everyone know we've now been through the biggies. The last 3 are less about how we stop the spread of COVID-19 through a facility, and more about how do we manage the effects of everyone having to deal with this disease. So strategy 5 is about managing your morale. And we just want to say, everyone want to feel safe, everyone's stressed out right now, and we want you to be thinking about that and actively managing it. So communication is going to be key. If you can come to your employees and say, we've got this plan, we've got this from trusted sources, and these are the best practices, here is how we are going to keep you safe, that's going to go a long way with A, the employees believing you, and B, them wanting to comply with the new measures. So, it's going to be very important to communicate early and often. But you might have to be a little creative about those communication forms. You're not going to be able to bring everyone into a room and talk to them for an hour. You're going to have to do, short meetings, maybe when the weather's nice, you go outside where it's a little less risky, or at least it seems to be from current data we have. Doing electronic communications, whether it's email or text, making a little video. You want to get this information to people, and you want to get them into probably bite-sized bits of information, so you're not overwhelming them all at once. And just remember that timeliness is going to be more important than polish. If in your benefits package you have mental health benefits, it's a good time to remind your employees that they're there and that they should utilize them. There's a lot of stress for people, not just worrying about getting sick, but managing whether they're working from home, having their kids at home, trying to figure out daycare situations, just trying to understand what is the best practices for them at home. How do they go shopping? There's a lot of things that are on people's minds that are probably weighing on them, and helping them find ways to cope with that is great. If you do have mental health benefits, in another webinar was said, make sure you remind people that it's confidential, because you get better utilization. And what you really want is your employees feeling safe and feeling healthy. And that's the bottom line. And along with that, it can be tough, especially in a manufacturing environment, but any flexibility you can provide them to deal with those things outside of their work, whether it's trying to find stuff for kids, parents, anything that's going on, just flexibility is great at this time. And if you can extend some flexibility to your employees, that's really going to help. Strategy 6 is about being flexible so you can stay up to date, because this is a fast-moving situation. 7 weeks or so ago, we were just going about our lives. And now we've been staying at home for 6 weeks, and now we're about to go to a new phase. There's hundreds of thousands of cases of this around the world. Everyone's trying to analyze that data, figure out what the best things are to do, and we can say it's going to change. And so you need to find some sources. The MEP, your county, state health departments, the districts, they're all going to be keeping up on this information. They're going to be trying to give you new guidance. Just be out there looking for it. Find somebody you can trust to pass on that information, so that when things change, you can change with them. And the last thing is strategy 7, which is don't forget the basics. There's now a lot of new information. You're going to be trying to train your staff and employees. You're trying to remember things. There's going to be a lot of focus on the new things you need to do. But at the end of the day, you're still a business who needs to be able to make quality products in a timely manner and do it safely. So you do need to remind your employees that the quality procedures and general safety procedures are important too. There's a lot of studies about factories when they go down for a week-long shutdown, or car factories month-long shutdown to retool for a new line. When they come back, you're more likely to have safety incidences and quality issues. So it's good, as you're talking to people and talking to your employees, that you make an emphasis on some of those basics. So before we move on, I do want to talk about one thing which we know from other groups is sort of the number one thing that people are asking about, and that's how to get PPE. All the PPE, masks, hand sanitizer, disinfectant, all this stuff is in much higher demand than it was. Supply chains from China have been disrupted. So we just want to point out that there's the repurposing project, which was the Ohio Hospital Association, Ohio Manufacturing Association, Jobs Ohio, the governor's office, or lieutenant governor, the MVP network have all been working together to help repurpose manufacturing capabilities here in the state of Ohio to make that PPE you need. And something they have recently launched is this Makers Exchange. And it's at the URL you can see on screen. It'll be sent out later. It is people here in the state of Ohio that are making PPE, just putting out there that they're making it. It's not an Amazon, it's more of a Craigslist where you can see what's available and then you can contact those businesses directly. But if you're having trouble finding masks or some of these other things, this would be a good place to go because it's coming from a local manufacturer, and you're going to be talking sort of person to person and not just putting in an order and hoping it shows up 4 or 5 weeks later. And there are some PPE resources that are not just in the state, but also in your county. So this lubrication specialist or specialties making hand sanitizer, that's in Morrow County. Cloth Mask, this is a company we have been working with here at the MVP at Columbus State. Costume Specialist, it's in Columbus, it's not far. These are people you'll be able to talk to and find out exactly when you make an order of when they'll be showing up. So I think this will be hopefully a really good resource for you as you're trying to find that. And if you are having trouble finding something else, that's another thing that these resources that we're about to be talking about can help you with. So with that, I'd like to reintroduce or bring back Andy Ware. Him and Jeff will be just talking about some of the resources that are here in the county and the state that can help you navigate this because you aren't alone. And with that, Andy, all you.
Yep. Thank you, sir. Well done. But as far as the county goes, we are really focused on trying to provide direct support to Morrow County businesses as much as we can. Try and do that by providing information directly to them about the latest information, say with the Small Business Administration loans. All that seems to be changing on a daily basis. And so we're staying in touch with the Small Business Administration, Columbus office. We have calls many times a week at times with Jobs Ohio and One Columbus, the Mid-Ohio Regional Planning Commission. They're all great resources. And what we're trying to do is just say, hey, if you have any questions, just call us at the development office. We may not be able to take a call right away, but we'll get right back to you. So that's what we're encouraging folks to do. And so then with that, I'll just turn it back to you, Mr. Spain.
Hey, thanks, Andy. So MEP at Columbus State is here to help Morrow County. What Manufacturing Extension Partnership, we're part of a State of Ohio initiative. So there are 6 different MEPs around the state. We're responsible for the 12 counties within Central Ohio. Our focus pre-virus was really to help organizations, manufacturers, to really drive their profitability, productivity, innovation. We were one partner really bringing multiple service solutions to the table. What we've turned to post-COVID or during COVID is how do we help you deal with this new normal? So one of the things that we've done working with the state and the federal level is a self-assessment checklist that we're going to be sending out to folks to help start looking at what resources can state, federal, local government bring to the table. It's kind of funny, we let people know we're with the government, we're here to help, but we really are. We're with the government, we're here to help. We want to figure out what is it you need and how can we help you best with it. So we've got some free assessments that we're going to be putting out. And when I say free, that's without cost to employers. We are going to be subsidizing it through our budget. We're going to help you with supplier sourcing. We're going to help you with training opportunities for workforce, really all the way down to workforce strategies. Some of the strategies that we've brought to the table recently, with the fact that we can't bring people together, we recognize that many manufacturers are having either a reduction in their workforce that they're trying to avoid. So how do they engage their employees in meaningful training, meaningful development? And we have some employers that have reached out to us that because of social distancing now have employees that are in different positions than they were before. And we're trying to work with them to upskill those folks, to give them the knowledge, skills, and ability they need. We're doing that through a virtual training. We stood up a complete training academy online, partnering with Tooling U, SME, and with Amatrol, 2 national curriculum providers. We offer these courses in conjunction with our faculty and staff, providing virtual, real-time, one-on-one coaching. And there's more about that on our website. I don't want to go too deeply into it. Many different disciplines online. There are 90-day periods of training development to finish up. at a subsidized rate right now. We did receive some additional funding to help out with that. When we're looking at workforce, when we're looking at what do people need, we also are recognizing that many manufacturers are going to have to look at how we deal with people if they come back. And Brent Maurer on our team has spent a fair amount of time really looking into individual companies and individual strategies and what you might need to think about from an HR standpoint. So Brent, could you share some of those outcomes with us?
Sure. Thanks, Jeff. And so I just want to take a couple minutes to raise a few ideas in your mind that you need to be thinking about during this time of transition. And then we want to open it up for questions. That's one of the real values of today, is the chance that you get to ask some questions. If you have questions already, start putting them into the chat. Maria is going to gather those questions and feed them to the panel so you can get your answers. So type your questions in if you have questions. But what I really want to talk about right now is, as you're getting ready to reopen, or as you're getting ready to ramp back up under the new guidelines from the governor, you got to think about some things. And one is that your employers are your most valuable asset. And over the next few months, your interaction with your employees is going to have a lasting impact on your company. First of all, I ask you this: have you called and talked to each employee if you've been shut down? Because those conversations are going to be critical. Oftentimes when you talk to employees, they have ideas. They're the ones who do the job on a day-to-day basis. They have best practice ideas constantly for you. A lot of times great innovation comes from just talking to your own staff. And in this case, they're going to have ideas about things that concern them, about close proximity, or has this been considered? They're going to ask for some accommodations, and you're going to have to make that decision. Is that something that you can do? Again, this is not a line item budget anybody came into 2020 with, but it's the fact that it's going to cost some dollars. It's going to hit your bottom line, but these are steps you're going to have to take. The other thing while you're having that conversation is you can talk to them about the policies that you're going to have in place for protection for them. So the things that David and Tom were talking about, that's now an opportunity for you to one-on-one give that to them. And you can outline the steps that you as a company are going to take and how you're going to protect them. And most of all, I think it's important that you have them acknowledge it by signing off saying, hey, I know that I play a role in this as well, and that my behaviors are going to have an impact on the overall protection that's in the workplace itself. So again, just a couple of things to think about there. The next thing you're going to find out when you're having that conversation is who's coming back and where the gaps are going to be in your workforce. The reality is that if you've been shut down, when you open the doors, not all your employees are going to be back in and ready to go. You've heard a lot of discussion in the news media recently about the surge in unemployment. In Ohio, we've had almost 1 million people file for unemployment over the last 5 weeks. If you go back to February, pre-coronavirus, we had 5.6 million Ohioans working. We're now down to just 4.6 million. So 1 million people have lost their job or been displaced over the last 5 weeks. So the reality is that when you call them back, many are going to come back, but there are also going to be some that are not going to be sure that they want to come back and expose themselves to like the potential risk that we've been discussing. So what you need to do is find out who is in and who's going to still be on the sidelines, and then prioritize the positions. You know, what are the essential operations you have to have, and what are the nice to have? You know, you need 5 people in this role. It's better if you have 10, but if you have 5, you can still operate. And then look internally to who's coming back. Do you have the opportunity to cross-train or shift employees around to fill gaps? The other reality of this is that you're going to be hiring. Believe it or not, with the surge in displaced workers, there are people out there that are going to be looking for opportunities. This is where you have to carefully consider your sources of talent. Employee referrals have always been valuable, but in this time they are really valuable, because if somebody is willing to vouch for somebody to come into the workplace, that's a big statement of trust in this point, that A, they trust you, and that they trust that person's going to come in and abide by the rules that need to be held in place. So employee referrals are very valuable. Job boards are always important, and there's been a surge in activity. Remember, through your Ohio Means Job Center there in Morrow County, by creating an OMJ account, you can get free Monster postings. Those jobs that you post on Ohio Means Jobs also go out onto monster.com. So that's one way that, without hitting your bottom line, you could start to get the word out there. You know, consider virtual job fairs. those are out there. I mean, maybe you have a virtual hiring event that you allow people to log on and fill out the application and talk to you. Also, keep in mind that if you are hiring, that's newsworthy right now. So be sure to talk to the local media and tell them that you're hiring. Every media outlet is looking for good news stories to balance off the daily COVID coverage. So that could be a big thing as well. And lastly, think about the hiring process, because you're not going to want people to have to come in and fill out an application. You're not going to want them to have to sit down across the desk from you and go through the interview process. Can you do some of this using Zoom or telephone or whatever? How much of it can be done virtually as opposed to actually in person? And to that point, how much of it can be done, how much of the onboarding can be done virtually? So finally, remember that to remain flexible. David mentioned this a few minutes ago, you're not in this alone. And so challenges are going to be arise, and you're going to have to make adjustments on the fly. And again, there's just a few of the partners that you have in this. But I mean, certainly Andy and Joel over at the Chamber and Eric over at the OMJ, all great partners. You know, you can pick up the phone and get hold of them, and they're there to support you. And likewise, the MEP at Columbus State is here to support you as well. So with that, I think we're nearing the end of this. I'm going to turn it back over to Andy, and we'll open it up for questions.
Thank you very much, Brent. That was a great explanation. Before we take questions, I would like to note that Morrow County Auditor Patricia Davies is also joining us on the call. She did a fantastic job as the Morrow County Development Director before she took her current position. And so just like to turn it over to her for a moment to make a few comments.
Well, thank you, Andy. This modern way to communicate and coordinate, and this makes me very happy. We've been in Morrow County, we've been trying to do modernization overall, and so this is wonderful. We appreciate the opportunity to help everyone, and I have a feeling it's continue for a while, so we might as well, this is the new normal, we might as well get used to it. I am hearing Jeffrey and Brent and David right. These are the new modern ways we're going to get business done. So well done. I appreciate the information.
Well, thank you. Thanks for being with us today on the call. While we're waiting for some of the questions to possibly come in, a couple that I saw, there was a comment that Tom Rogers made or mentioned about HVAC filters. And I wanted to answer that we did have the opportunity to connect with Professor William Hiley at Columbus State Community College's HVAC department. And Professor Hiley definitely said, yes, changing out filters would be a helpful thing, agreed with using the HEPA-rated filters. He did want to call out an earlier webinar that he had heard, talked about people saying to double up on the size of your filters. And Professor Hiley said, absolutely do not do that. Do not just stuff your filters in. He was kind of tongue-in-cheekly said it'd be the equivalent of putting in a sheet of plywood. Sure, it'll stop the virus from going through and airflow. He said use a HEPA filter. Talk to your vendor about what you might need in there. And he also said something we hadn't thought about for your maintenance staff that is changing your filters out. They may need to give some heavy consideration to donning the appropriate PPE when changing those filters. So keep an eye on your HVAC filters. We also had one that Dr. Stein mentioned tissues, and put tissues in trash cans everywhere. It is an inexpensive way for you to take care of it. We did a quick search on just Amazon. 6,000 tissues from Amazon's running you about $89 right now. Small wire trash cans running $5 to $6 a piece. Think about those costs versus having 5, 10, 50 employees out at one time, which is not out of the realm. Having the opportunity for someone to blow their nose on a tissue and then throw it away, just get those out there. That's a nice, easy one to do. Brent had called out the Manufacturing Alliance Marketplace. We're going to send you links on that. Again, that is Ohio manufacturers helping Ohio manufacturers. Things that are hot and heavy on that right now from the governor's task force, With regards to PPE, we are seeing the demand for shields, particularly within manufacturers, the plastic see-through shielding. What we're hearing from some folks is the cotton mask that folks are wearing. If you're a loud environment, might be a little bit harder, so the shields can help with that a little bit so you can see the mouth. The best recommendation is wearing the mask and the shield. We're seeing a run on thermometers, so we'll try to get some of those linkages for you. Signage. Dr. Stein also mentioned, as you're putting up signage for how you move through your organization, locally, Hartman Printing is a great resource to reach out to if you need to have some signs created for letting people know we're entering this door now. Behaviors take about 3 weeks to change. So you've got 21 days to change someone's behavior. If they've come in the same door for a decade, you might need to help reinforce it with some signage to let them know you're going a different direction. If you need to remind someone, wash your hands frequently. And even though we teach it to our kids, sing those ABCs, that takes some time to help reinforce that. Use some signage. Disinfectant, we've heard repeatedly about washing down surfaces. Talk with your janitorial team, or if you have an external vendor. I can tell you, Columbus State Community College, we're a school of about 27,000 students. The firm that we outsource our janitorial duties to, even though we're closed right now, they're still hitting every surface every day. And we've posted checklists for our employees to see when an area has been cleaned. So that might be something to think about. It's talking with your service and not just assuming that they're doing stuff. This may be the time to step it up a little bit and let them know, here's how we want door handles cleaned. Here's how we want drinking fountains cleaned and how often. Take it down to that individual behavior if this is what we're looking for. Maria, as we've kind of coming to the closing few minutes, any other questions that I might have missed over chat that you want to call out?
Yes, actually, we received a question, and it is there guidance on taking temperatures of employees and recording or not of this information? And Stephanie said that she would take on that question for us.
Oh, thanks, Stephanie.
Hi. So we've had to do a lot of these things that we're asking, your companies and stuff to do because we were essential, so we've had to be working through this whole thing. So what we do for temperature monitoring is we're lucky enough to have one of those scan your forehead thermometers, but as long as you have a thermometer with the covers and stuff on it, it's fine. But we just have that in a centralized location, and then every person who comes in at the beginning of their shift has to go and take their temperature, and then we have my staff made a spreadsheet like log thing that just had everybody's name on it, the date, and then you just write your temperature in there. And if you have a temperature that's over 100.4, you need to go notify your supervisor because we're going to send you home. That's considered a fever. But we just do that every day when you come in for work.
That's perfect. Stephanie, any recommendations for larger companies? If you're a Cardington, Utaka, and you've got the volumes of employees that are coming through the door, have you seen any best practices in place for how people are dealing with that?
So before they decided that Cardington was going to close down, because they were open for a while, they were, if I remember right, they were filtering people through the employee health office when they would come in, and everybody would get their temperature taken.
Okay.
They had a setup that was unique to them that they were able to move people through. I'm sorry.
So it can be done. It's where we've seen with some of our larger manufacturers working with around the region where they are still getting people through at a very reasonable rate of time.
Yes, I think so. And I think that it's just going to be a matter of being a little creative with how you're going to do it. Maybe if you're big enough and you can get enough thermometers, you could set up a couple of different stations for moving people through. But as we're all moving into this new sort of normal, it's just going to take some just creativity and trying to get people through things as best you can.
Perfect. Well, it looks like if I'm reading my chat side correctly, we've answered all of the incoming questions. I know that we are definitely looking forward to a steady state. How do we continue to move forward? Brent, do you have some more thoughts you want to share on next steps?
Actually, before that, Jeff, do we have time for one more question?
Absolutely, absolutely.
Great. So we do have another question, and this says, do field personnel in vehicles or working outside space appropriately need to wear masks? Did I read that? Did you guys
You
hear
did?
what I said? Okay, great.
I saw Stephanie's mouth moving, so I thought maybe.
So, I mean, I don't have a definitive answer, but I think if you're in a vehicle and it's just you in a vehicle, you probably don't need a mask on. If there's more than one personnel person in a vehicle, then yeah. You know, working for Columbia Gas and you're out there digging, if you're not going to be super close to people, you really wouldn't have to wear a mask. But it's just if you're going to be within that 6-foot distance, and then if you're inside, it's just better when you're inside. That would be my take on it. But there's no official. I was looking at stuff on my other screen. There's no official guidance about that.
I think that's a great solution. Remember what the barrier is there for to help out. So, you know, if you're in your vehicle by yourself, probably don't need to be wearing your mask. If you're around other people. Yeah. So
I add two things. One is that I'm fairly sure that the governor's guidance is that the masks are inside. You know, that it's not mandatory to be outside. And then if you're in a vehicle with other people, as long as the weather is nice,
put your windows down.
Yes, put the windows down. Even one window, 3 inches down. There have been some modeling work done, so it's a study, a modeling study where it can really cut down on the amount of accumulating virus just by having little ventilation. So it's not necessarily mandatory guidance from the state, but that would be a best practice, that as long as it's not raining or too cold, that having windows cracked can really help.
If you've ever had to sit around in a mask anyway, if you're in a mask in a car with 3 people, the airflow is going to be, it's going to help you feel more comfortable. It definitely takes some getting used to. I wore a mask to the grocery store the other day for the first time. I couldn't stop fiddling with it and touching it. But then as time goes on, you get more used to it. But yeah, having the window open whenever you can, you're going to feel better because you get hot in this thing.
And in the HVAC in the vehicles, you want to have it on the bringing the fresh air, not recirculating.
Excellent point.
Just another small thing.
Excellent point. Well, we've got a key contacts form that we're going to put up for you so you can see what's coming up and what we're looking for. I'll reiterate what Brent had said earlier. We are going to send out to everyone a copy of today's deck. Our FAQs that we're collecting, we believe that Andy's going to have a copy of the recording to put on his website. And there's a couple documents we'll send along that the MEP at Columbus State has put together, 7 strategies for how to best mitigate the spread of COVID-19, and another document that Manufacturing Extension Partnership put together on a COVID preparedness checklist. So look for those in your incoming email. Please don't hesitate to contact any of us with any questions. That's what we're here for. We very much want to help you. With that, thank you for your attention and all the great assistance going through that. And have a great day. Enjoy the rest of it.